Two lives, one beginning. The hidden journey of conjoined twins in the womb. Conjoined twins begin a quiet, complex journey deep inside the womb, one that unfolds cell by cell, heartbeat by heartbeat. Imagine discovering that two babies began as one life and never fully separated. In this video, we reveal the hidden stages inside the womb that shape conjoined twins, from the first split to the earliest heartbeats. Stay with us till the end for the full picture and subscribe for more powerful educational journeys. Let's break it down clearly. The exact beginning: one egg, one sperm, one life that becomes two. Conjoined twins always start as identical twins. This means the journey begins with one egg fertilized by one sperm, forming a single fertilized cell called a zygote. In a typical identical twin pregnancy, this zygote divides completely into two separate embryos within the first 3 to 8 days after fertilization. In conjoined twins, however, something different happens. Between day 13 and day 15 after fertilization, the embryo attempts to split, but the separation is late and incomplete. At this stage, the embryonic disc, the flat group of cells that will form the baby, has already begun organizing the body plan. Because the split happens too late, the embryos remain physically connected. This timing is crucial. Earlier split gives separate identical twins. Very late split gives conjoined twins. The connection depends on where the split stopped: chest, abdomen, pelvis, head, or spine. Implantation: one placenta, one support system. Once the partially separated embryo implants into the uterine wall around day 6 to 10, the pregnancy continues as a single gestational unit. In nearly all conjoined twin pregnancies, there is one placenta. There is one chorionic sac, often one amniotic sac. This means both babies share the same oxygen supply, the same nutrients, the same hormonal environment. From the very beginning, their lives are biologically linked. Feeding in the womb: how do babies share one lifeline? During the first trimester, feeding happens through the placenta and umbilical circulation. Here's how it works step by step. 1. The placenta attaches to the uterine wall. 2. The mother's blood delivers oxygen and nutrients. 3. These pass through the placenta into shared blood vessels. 4. Each twin receives blood through umbilical connections. However, feeding is not always equal. In some conjoined twins, one twin may receive more blood flow. The other may receive less oxygen or nutrients. This imbalance can affect early growth and organ development, even before the mother knows she is carrying twins. Weeks 4 to 5, organ formation begins together. By week 4, the most critical stage of development begins: organogenesis. During this time, the heart starts forming. The brain and spinal cord begin developing. The digestive tract starts shaping. Limb buds appear. In conjoined twins, shared body regions also mean shared organs may begin forming. Shared liver, shared intestines, shared heart chambers in rare and severe cases. If the twins are connected at the chest thoracopagus, their hearts may develop very close together. If connected at the abdomen omphalopagus, they often share liver tissue. The first heartbeats, a powerful and delicate moment. Around week 5 to 6, heart activity begins. This is one of the most challenging moments in conjoined twin development. Some twins develop to separate hearts. Others develop hearts that are partially fused. In rare cases, there may be one functional heart. The way the heart forms early in the first trimester greatly affects survival and long-term outcomes. Growth challenges in the first trimester. The first trimester is already a fragile period for any pregnancy, but for conjoined twins, the challenges multiply. Some key difficulties include limited space for movement, unequal blood distribution, delayed growth in one twin, higher risk of miscarriage. Because their bodies are connected, stress or developmental problems in one twin directly affect the other. Brain and nervous system development. By week 7 to 10, the brain grows rapidly. Most conjoined twins have separate brains, separate nervous systems. However, if they are joined at the head craniopagus, parts of the skull, blood vessels, or brain tissue may be shared, which adds complexity to development and future treatment. emotional and physical reality inside the womb. Though we cannot measure emotions in the womb, conjoined twins experience constant physical contact, shared movement patterns, interdependent growth rhythms. Every kick, stretch, and turn is shared. End of the first trimester, a clearer picture emerges. By week 11 to 12, ultrasound imaging can clearly show the point of connection, shared organs, heart structures, growth differences. At this stage, doctors begin careful monitoring to understand viability, possible complications, long-term outcomes. A powerful lesson from the womb. Conjoined twins remind us that human development is not mechanical, it is miraculous, delicate, and deeply complex. From one cell to connected lives, every stage of the first trimester shows how closely life depends on timing, balance, and care. Their story does not begin with challenge, it begins with connection. And that connection starts long before birth. If you found this educational and exciting, please subscribe, like, and comment your thoughts below. Tell us, what part surprised you the most?